Brain aneurysms are balloon-like structures. Because they have very thin walls, they may have a tendency to burst. And if they burst, they cause severe torrential bleeding within the brain, which is a medical emergency. And there are certain other aneurysms which may not burst, but they may produce certain symptoms. So what are these symptoms which can be produced by these silent aneurysms? They are drooping of eyelid, headache, swaying while walking. If the aneurysm ruptures, it is a high risk condition because it can cause 50% mortality or case fatality. So it is very important to have timely and preventive way of treating these aneurysms to get good outcomes and to prevent case fatality or mortality. So how the aneurysms are treated? They are treated by the conventional open surgical clipping or endovascular coiling technique. But all aneurysms cannot be treated with these traditional methods. So what about the aneurysms which are more distal, that means more into the brain, not at the proximal site, or more complex like dissecting fusiform aneurysms? So for those which are complex and distal in location, we have a state-of-the-art technology which is advanced called as flow diverter technology. So these flow diverters have changed the way the complex aneurysms are treated. So basically the flow diverter is a thin mesh tube that consists of small ultrafine metal strands. So how the flow diverter will work? Basically it is inserted through a small catheter that is inserted from the groin across the aneurysm into the brain blood vessel. Once placed, it diverts the flow away from the aneurysm into the parent artery. So the weak point or the aneurysm gradually shrinks over a period of time and forming an endothelium or a natural layer across the defect, causing it to completely cure with a durable outcome. The advantages of flow diverters being that it doesn't require an open brain surgery. So it is done entirely from an endovascular point of view, and patient does not need to stay more than 2 days ideally. And it is a natural healing process because you are basically healing the defect point at the aneurysm site. Do you know there is an advanced flow diverter technology? That is shield technology. So what is shield technology? Shield technology is basically ultra thin coating inside the flow diverter lumen that basically mimics the lining of the blood vessels. So what are the advantages of this particular technology, the shield technology in the flow diverter? Because it mimics the natural lining of brain blood vessels, what happens is that the healing is more faster, more natural, and at the same time the stent blockage risk or stent thrombosis risk is very minimal as compared to conventional first generation flow diverters. Apart from that, the most important thing is that the antiplatelet dose or the blood thinner dose you need to administer or needed to take along with flow diverter is significantly shorter and simpler as compared to the first generation flow diverter technology. So let's divert to AVAT.